Good evening. Welcome back to the next edition of my Ask Me Anything, where I try to help you guys become more heart attack proof. I'm Dr. Twyman, board certified cardiologist who owns Apollo Cardiology in St. Louis, Missouri. If you're ever interested in potentially working with us, we still do have some availability left in 2025, but I'm now booking out into January for most of my new appointments. So if you're interested in potentially working with us, go to drtwyman.com and apply there, and my team will contact you. A little housekeeping before we jump into the great questions, as always. One is if you're signed up to go to the Canyon Ranch retreat with me in October, November, be on the lookout with a Telegram message this week. The schedule came out. If you download the Canyon Ranch app, you're able to start booking your services, also the classes, and also the hikes. I'll let you know in the Telegram group which ones things I'm signed up for, and we'll stay in touch that way. So for those that are in the Telegram group, nothing else to do. But if you're following me and have not received an email from me previously, then hit me up with the DM and Instagram, and I'll make sure you get connected into the Telegram group, because that's the way we're going to stay in touch at the event. Second piece of information, Silverback Summit. This will be the third time I'll be speaking at it. It'll be in November in Orlando. Ellie Gilbert, good friend, woman's extraordinaire on testosterone replacement therapy and all things men's health. Silverback Summit, I'm going to be a speaker talking about vascular health, testosterone replacement therapy. Allie has been kind enough to give me 3 tickets to give away to people. So be on the lookout. If you're following me on Instagram, particularly doing these IG lives, I'll give away the tickets during this event. They're worth a couple $100 each. And then third piece of information to share tonight, the school community is up and running. It's drtwyman.com/school. Or if you go to the school platform, which is skool.com, and search for Heart Attack Proof, you're going to find me. I have a group of people in there that, right now it's every 2 weeks. We've been doing some IG live type Ask Me Anythings on Friday afternoons, but people are able to pop up live, share back and forth with me. This past week we did a deeper dive into lean mass hyperresponders, and we're also sharing information about different vascular testing gear. I'm going to do a demo of the Connect UT blood pressure device in there this week. So that's where I'm going to be sharing my long-form content, and people have more easy access to me back and forth. If you're part of the old Facebook group, I'm going to be transitioning off of that platform and then moving more of that over to school. So that's why that platform is on pause for the time being. I will give you more information about how to follow me going forward if you want to off of Facebook over to the school community. So with that being said, with the housekeeping, we'll jump into the questions for tonight. First question up tonight, can endothelial dysfunction be reversed? Yes, that's my expertise that I look at Apollo Cardiology, is to find people's reasons for the endothelial dysfunction and remove those. So the endothelium is the inner lining of your blood vessels. It's 1 cell thick. If you're able to dig out all your endothelium, it'd be the surface area of 6 tennis courts. It's the basic force field, or the first line of defense, that it determines what stays in the blood versus what has access to the arterial walls. Can you improve it? Yes. Figure out what's damaging it. Is it heavy metals, plastics, air pollution, high uric acid, high homocysteine, high insulin? There's hundreds of things that can damage the glycocalyx and the endothelium. Remove those insults if you can, and then start supporting the endothelium. And there's various products that help support the glycocalyx and optimize nitric oxide levels. Next question, what would be a good next step to take if someone's plaque was found on a CT coronary calcium scan? Work with a doctor who knows how to get to the root causes of why you have plaque on a CT coronary calcium scan. That'd be the first step. Plaque is very common. If you go looking for it, you often find it well before the person's symptomatic with chest pain or having a heart attack. So it starts with endothelial dysfunction. You have oxidative stress and inflammation that persist. You have lipoproteins retained in the intima. You start causing more and more inflammation and plaque in the arteries. So you got to figure out what is damaging the endothelium and contributing to the persistent inflammation. Blood tests and genetic tests can often point you in the right direction. Should you take CoQ10 if you're taking a statin? The short answer is generally want your CoQ10 level over 3. So if you need to take a supplement to do that, then by all means do that. Do I prescribe peptides for atherosclerosis? No. There are no FDA-approved peptides for atherosclerosis. What are the top biggest causes of heart disease? As I was taught by Dr. Mark Houston, there's over 400 items. The big five, high blood pressure, high blood sugar, high lipids, obesity, and smoking are the top five, but there's 395 other things that damage the arteries. So think of it more as what's damaging the glycocalyx and the underlying endothelium, and work on that. Next question. Somebody says that they take metoprolol for a fast heart rate. Cardio brings it to 140. Is this safe? No pain? So I cannot answer one-on-one medical questions. I don't know your whole story. I don't know why exactly you're on metoprolol. And metoprolol is an AV nodal blocking agent. So do you have a fast heart rate because you have inappropriate sinus tachycardia? Do you have supraventricular tachycardia? Do you have atrial fibrillation? Unknown. And it's going to act as a regulator of your heart rate. So generally you're not going to be able to get your heart rate up to 220 minus your age when you're on a beta blocker. So unknown if it's safe because I don't know your story. So you have to talk to your doctor who prescribed it to say, is a heart rate of 140 safe? Awesome. Somebody sending in a message from Brussels. So the woman is 66 years old. She has an ApoB of 100, which is approximately the 50th percentile. So 50% of people have values higher than that. On a statin, low dose, rosuvastatin 5 milligrams. Is this enough for plaque of 20%? Potentially. It depends on if the ApoB decreases to under 70, ideally under 60 on that dose, and then titrate up if needed. If you have access to a Boston Heart Diagnostic Panel, then you can understand that if it's, disc muscles getting suppressed with that dose of rosuvastatin, and then potentially add ezetimibe to the regimen if need be further lower reduction in ApoB. I think this was a continuation of the question, or should you combine with ezetimibe? Potentially. It's a good combo. I use it routinely in patients who aren't getting to goals with one or the other alone. So think of the statin as, I use the analogy sometimes as cholesterol is water going into a bathtub. The statin's like taking the faucet and you're down the faucet back, so not as much water is going into the bathtub. And ezetimibe is basically making sure that the water flows out to the sewer, doesn't back up into the bathtub. Next question, is red meat not advisable for people with plaque in their arteries and who have a stent? No, that's a falsehood. Red meat by itself is not the problem. It's some people's tolerance to saturated fat that sometimes is an issue with their lipoproteins, but test don't guess is how I was taught. So, if you really need to know is saturated fat an issue, you can look at your ApoE genotype. You can look at genes that affect lipoprotein lipase. The GB Health Insight Panel is the one that I do with my patients. What are the ways to keep inflammation low? Think of inflammation as too many protons, not enough electrons. So from a quantum standpoint, get outside, grounded, feet on the ground, get some electrons from the earth. Sunlight exposure to your surfaces helps charge separate the water that's in your body into negative and positive charge. Nutrition-wise, omega-3s, monounsaturated fats like olive oil can potentially help. And then looking at biomarkers to figure out, okay, why is inflammation high? It's a marker that your immune system's turned on. Is it an autoimmune issue? Is it a chronic infection? Is it air pollution? There's many things that drive that. But if you go looking, you often find the cause of the inflammation and then treat the root cause. Next question, if a person already has cardiovascular disease, would it benefit them to come see you? Those would be the people who would benefit the most. There is primordial prevention, meaning you have absolutely no plaque in your arteries, but most people aren't looking at an early stage. Most of the time, if you look and the person's over 40, you're going to find something, or at least you're going to find inflammation in the arteries. So it depends on what stage of life, would somebody still be considered primordial prevention. Primary prevention means you've not yet had a heart attack or stroke, but almost all the old studies don't include using CIMT scans looking at carotid arteries or using calcium score tests to look at coronary arteries. Those tests are looking for asymptomatic or subclinical atherosclerosis. So you find plaque in those people, they're probably still not technically primary prevention. They actually have plaque in their arteries, and plaque promotes cardiovascular events. The more plaque, the higher the risk of having a stroke or heart attack. Secondary prevention means you've already had a heart attack, stroke, you have stents, you've had bypass surgery. I take care of many patients who, had these events before they first, came to me, but I can say that in the 6 years that my practice of polycardiology has been open, if somebody had an event before they had seen me, they've not had another one. So yes, it's still always a good time to see us. If you come see us, we can tell you, did you fix your endothelial dysfunction? Because if the person doesn't fix endothelial dysfunction, they're more prone to keep developing plaque in their arteries. And this was one of my aha moments, and why I ultimately decided to kind of step away from the cath lab, is that we treated many patients, at the end stages of vascular disease, right on the brink of dying sometimes. And if we don't fix their endothelial dysfunction, they would be back in the cath lab a year or 2 years later, having more plaque ruptures. So you have to look at the endothelial lining. There's testing that you can be done. You can do an endopat scan. You can do pulse wave velocity testing. You can do central blood pressure. So test, don't guess is the philosophy on that one. And then the last pre-submitted question: can the coronary arteries and the arteries in the body wear out if too much sugar and seed oils? So not necessarily wear out, but high sugar and seed oils, which are high in deuterium, they can cause damage to the endothelial glycocalyx, which is the lining of the endothelium. And if the endothelium is damaged, that's the doors are open. You're more prone to developing plaque. So it's not that the arteries wear out, it's that they get inflamed and damaged from those things. All right, so those were the pre-submitted questions. I don't see any other questions in the comments. If any pop up in the next minute, I'll answer those for you guys. Every Monday at 6 p.m., we answer these questions, helping you become more and more heart attack proof. The archives of these videos are on my YouTube channel. You can just go to drtwyman.tv, or if you go on YouTube and just spell out my name like above, DRTWYMAN, you'll find the site. My newer content is going to be housed at my school community. I'm phasing out the old Facebook group. School community is going to be a place where I can do more of these type of lives. I've had patients, log on, or people who are interested in, heart attack proof philosophies, join the Zoom calls that we're doing on Friday afternoons. Do them at least twice a month for the time being until we kind of build up the group. And I also have, a couple different courses in there, courses on how to read your own labs, how to become heart attack proof, how to think about nutrition. All those videos are in the school community, and there's a free 7-day trial if you want to check it out. So it's drtwyman.com/school. All right, and then there's 2 questions that popped up. What might cause a sudden rise in blood pressure, causing weakness in the legs? Those would not likely be related. If there's weakness in the legs, then you'd be concerned that the person has had a stroke. So that's the only way I can see that they'd be linked. Otherwise, weakness in the legs is going to be claudication. That'd be blockages in the lining of the arteries going down to the legs. Sudden rise in blood pressure, it could be catecholamines, it could be inflammation, it could be a drop in nitric oxide, it can be a drug-drug interaction, a supplement drug interaction. So we'd need a lot more information to fully understand that. But if there's weakness in the legs, this means you have to go talk to your doctor like tomorrow and figure this out. Next question was, I have high LPLA and calcium score in the low 200s. My cardiologist wants me on a plant-based diet. Do I recommend that? The short answer is generally I do not, unless that's the patient's choice. I don't recommend it as a standard of care for cardiovascular patients. Nutrition is complicated. If you've heard me talk about anything in the past 6 years, I don't espouse that there's only one diet for people. It's going to depend on your mitochondria. So it depends on your mitochondria, which are engines. They're what burn your foodstuffs. Depends where you live in the world. Depends on the season. Depends on how well you metabolize certain compounds. Do you metabolize carbohydrates well? Do you metabolize fats well? Do you have an ApoE4 allele? Do you have issues with insulin resistance? Do you have issues with saturated fat? It's more complicated to say eat one way or the other. You have to look at biomarkers to figure it out sometimes. Rough questions I ask patients before they start working with me is, what time of day do you stop eating? 4 hours before you go to bed is usually a good start. 3 hours is kind of the bare minimum. That helps set off the liver and gut clocks to turn off for the night. Seafood, extremely important for the DHA component. You need probably 3 to 4 servings of seafood a week to optimize your omega-3 levels. That helps keep inflammation low and stabilize plaque. And then the third piece of information is you need enough protein to maintain your muscle mass. Your muscles are what control about 80% of your glucose disposal. So 1 gram of protein per pound of ideal body weight. So if you're a 160-pound individual, you need about 160 grams of protein a day, and you break it down to 40-gram servings. So that's what I would start with, and then we'd figure it out based off of genetics and biomarkers. All right. So I don't see any other questions coming in tonight, so I'll let it wrap up here. So I appreciate your guys' time and attention as always. I'll be back next Monday, 6 p.m. Central Time. For those that joined, the archive will always be in my Instagram feed for, I believe it's for a month, but the ones that are older than a month, they end up on my YouTube channel, drtwyman.tv. I noted that I will be speaking at the Silverback Summit in November in Orlando. More details will be forthcoming. I do have 3 tickets I can give away, so be on the lookout. I'll start giving them away on the IG Lives. So have a great rest of the night, guys, and see you next Monday.